Anyways, I'm really pleased to be here, and being this old, I'm pleased to be anywhere. But I'm particularly pleased to be here because I really believe in the concept of health literacy, and I really want to see it being actualized in practice. And so my agenda here is to try and use this meeting as a lever to increase the momentum in Canada. I don't think Canada is as sterling an example as people from other countries say. I think we have a few shortcomings, which I think we need to acknowledge. On the other hand, we have accomplished some reasonably good things here in Canada and have started to move forward in this field. So what I wanted to do was just give you a quick overview of how this field has evolved in Canada. And in particular, I want to talk a little bit about some of the key features of health literacy work in Canada, some of the milestones, recent initiatives, recent research, and current trends and projections. So these are some of the key features that I see and other people see in health literacy in Canada. In contrast to the States, the momentum and the leadership for health literacy has tended to come from the public health field rather than from the healthcare field. And I know the States is now catching up to us, and public health is getting more and more involved with people like RIMA pushing them. But in Canada, public health was at the table right at the beginning and is still at the table. Another thing that I think has characterized health literacy in Canada is that we have been in partnership with the education and literacy sector right from the get-go, and are still in partnership with that sector. And some of the people here are from that sector, and we are working quite rigorously with them at the present time, and I envision that we'll continue to do it. It has to do with the same kinds of things that Rima was talking about earlier, about the importance of literacy, because I think, personally think literacy is absolutely fundamental to health literacy. I don't believe you can really be health literate without being literate. I think we've done some innovative things, and I'm going to talk about a few of those, both in practice and research. But on the other side of things, there are really no explicit government policies, as far as I know, either at the federal level or the provincial level on health literacy. And maybe some of my colleagues will correct me in this. I hope that they can say something about policies that exist, but personally I haven't found any. So this is where I think we're quite weak. That we also have not involved the private sector as much as private sector has been involved in the States and perhaps in the UK as well. Pfizer played a big role at the beginning. I'm not sure how big a role they're playing now, but they certainly did play a role. Whereas here, we haven't actually courted the private sector to be involved in this area. So it's something we have to think about, because there are downsides to that as well. And thirdly, I think I'm right in saying that there hasn't been very much interest in chronic disease management specifically in relation to health literacy, using that label at least. But I think that's changing a bit with people like Mark coming into the field. I'm glad he actually rose to my challenge. Maybe there's 2 or 3 other physicians in Canada who have, but it's nice to have Mark on board. Oh, there you are. And I hope you don't get discouraged because of this meeting. Anyway, so these are some of the key milestones in the development of this area in Canada. It actually started out with the Ontario Public Health Association in 1989, working with Frontier College on a project to look at the relationship between literacy and health. And so they did some things like review the literature and went out to see what was happening on the ground. And this in turn gave the CPHA, the Canadian Public Health Association, an encouragement to get into this field as well. By the way, the original interest came from all the publicity that was in the media about low literacy levels in Canada, more or less the same as in the States. So the CPHA established a national literacy and health program in 1994. I don't think it formally exists anymore, but in its heyday, it had 27 national organizations in health and literacy working together on literacy and health. One of the things that they did was they organized the first national conference on literacy and health, and Rima was there, and Scott was there, and maybe some others in this room. But that's, I think, where the concept of health literacy actually surfaced, because most people in the field up to that time were talking about literacy and health. And people still are talking about literacy and health, but now the concept of health literacy has become more popular. At that conference, which was 13 years ago, almost to the day, the three of us, did a workshop on health literacy. And that was, I think, the only thing in the conference that actually used the concept of health literacy. Well, the next conference that took place in 2004, the tide had started to change a bit, and there were quite a number of sessions on health literacy. And we produced a publication following that conference that had about 5 or 6 chapters on health literacy. And some of the authors of those chapters are actually in this room. So health literacy started to catch on, and I think one of the stimuli for it actually was the IOM report, because it was released just before that conference, and Rima talked about it, and I talked about it, and other people at this conference. And one of the recommendations of this conference is that Canada set up an expert committee on health literacy, like the states had done. And so in this case, we were following the states instead of letting the states follow us. But that particular recommendation was approved by the conference, but nothing happened for a little while. The government didn't pick up on that recommendation, but what happened more generally at that time was the government established what was called the Canadian Council on Learning, which was set up to encourage learning, development of knowledge about learning, and encourage learning practices across the country. So that particular organization adopted health literacy as one of its cross-cutting issues, and the Health and Learning Knowledge Center that was at the University of Victoria, which I was the executive director for a couple of years, devoted a significant amount of its budget to supporting the expert panel on health literacy. So that's how the expert panel got started. I ended up being the co-chair of that panel with the president of the Canadian Public Health Association, and then with Deborah Gordon-Elbabetti, who led the literacy and health program in Canada. Scott was on the panel. Linda was on the panel. Who else was on the panel? Yeah. Iraj, okay. So some of the panelists are here. What I've done is I've loaded this room with my friends and people who work in health literacy. Mark didn't know this, but now he knows. So one of the main recommendation that we made was that Canada needs to develop a pan-Canadian strategy for health literacy and to implement it. Well, so far that hasn't happened, but other things have happened in the meantime. One of them was the institute that the Center for Literacy in Quebec organized in Calgary, of all places. You wouldn't expect that Quebec organization would have an institute in Calgary, but they did. And following that, a number of people who were at that institute, including Andrew, myself, Linda, who else was there?
Cliff Coleman.
Anyways, the point is that we had a kind of mixed group from Canada and the United States, and we worked on this charter, circulated and released it. And it was one, I think, of the first documents that kind of drew attention to the professional side and the organizational side and the system side of health literacy. We talked about health literate organizations and health literate systems and that sort of thing. So I think it was a useful document. Not that we were the only ones who were doing that. So that kind of brings us up to today, and I just want to say a bit about some recent national initiatives in health literacy. These initiatives all were supported by the Public Health Agency of Canada, which has adopted health literacy as one of their priorities. And Sandy was hired by them, I guess it's about 3.5 years ago, to develop a program in health literacy. And these are some of the things that Sandy and some of her colleagues have accomplished in the last 3 years. Sandy and I and others organized a reference group and 3 think tanks on health literacy, all of which were held here in British Columbia because the Public Health Association was kind of the contractor for that initiative. And as a matter of fact, I kind of see this meeting today as a continuation in some ways of that think tank, because a bunch of people here have been planted by me because they were at that think tank. And the point is that the Public Health Agency has kind of ground to a halt. Maybe I shouldn't say this publicly, in terms of what they're doing in health literacy. And so I think any opportunity to keep the ball rolling is worth taking, and this is one of those opportunities. Other things that Sandy headed up were an example from the field project, which gathered exemplary examples of health literacy practice across Canada. She also engineered the Public Health Agency to develop some online health literacy modules. She wasn't responsible for the embedded learning project, but that was done by other people in the Public Health Agency. Basically, it's a project that was done in 3 provinces that looked at health literacy practice in 3 different contexts. The agency also sponsored the Canadian Medical Association and the Canadian Nursing Association to develop an online continuing education project in health literacy, which is now available to people in the field. The Public Health Agency established a web page and a tool to develop capacity for health literacy was commissioned, and Jim Frankish, sitting at the end of the table, also known as Santa Claus, directed that effort, and is probably going to say some more about it later on in this workshop. So there was a lot of action for the last 3 years, and as I said, my impression is that it's kind of ground to a halt. And I also regret to report that the Canadian Public Health Association work in health literacy has kind of ground to a halt. One of the things that they were doing was trying to set up a National Council on Health Literacy, which was one of the elements of our report. I learned officially that, in fact, that is off the table at this point in time because of leadership and because of lack of resources to do it. So at the same time as Public Health Agency has been active, there have been other actors in the field. First at the national level, there have been that should be CMA, Canadian Medical Association. They passed 2 resolutions within the last year on health literacy. One of them is to set up a national strategy on health literacy, which seems to hark back to our expert panel report, so it's not dead yet. And secondly, they recommended that an awareness program be developed for physicians to let them know about the importance of health literacy in relation to quality control, or patient quality of care, rather. Then at the provincial level, I think Quebec and BC may have been more active than other provinces. I know that in Quebec, the Center for Literacy did a scan of French health literacy resources, and the Institute, which Odette is with, also has adopted health literacy as a priority, which is great. I'm really pleased to hear that. We have been really active here in British Columbia, partly because of the Institute that we all went to, because at the end of the Institute, Marina and I and several other people from BC said, you know, it looks like it's not moving nationally. Let's get together and do something in BC. So we've been very active and proactive in this area. There has been, the government here has sponsored a health literacy collaborative that took place in 4 communities across BC. It matched community primary care physicians with literacy leaders and with learners in those 4 communities, and developed a number of resources that I think are quite good. And we'll hear more about that from Connie, because she directed that. Secondly, what we did was we ended up establishing a health literacy network here in BC. Which is really a network of networks, because there already were several networks. One very strong one was on mental health, health literacy, but then there's the Librarians Network, which Marina is involved with, and several other networks. So we've brought them all together under one umbrella, and we're trying to keep interest in the field moving. We've sponsored a number of workshops. Marina's going to talk more about it on Saturday. Then another thing that happened was the Public Health Association of BC did a 2-day workshop, or a summer school on health literacy a couple of years ago, and that was in partnership with the literacy community. And we ended up, as a result of the think tanks, producing a discussion paper on an intersectoral approach to health literacy. The Public Health Agency didn't want it to appear under their auspices, and even though they had funded it, and so it's on the PHABC website, as well as on the website of the National Collaborating Center on Determinants of Health, in both English and French. And so that's out there, and so far it's getting a fairly positive response. In terms of recent research, these are the areas that I think we've mostly been working on here in Canada. A lot of attempts to develop measures. CAM has developed a measure of e-health literacy. Our own group here in BC has developed a measure of literacy within student populations. And there have been other efforts as well, including efforts by Scott, which is on the website of this institute, and I think Scott's going to talk about his online skill set later on. We've also done a lot of analyses of data from the International Literacy Survey, mostly led by Scott, but financed by the Canadian Council on Learning. And Scott has continued that work, even though the Canadian Council on Learning no longer exists. That's also, I'm sure you're going to talk about that as well later on. There is a big interest on doing work in the area of culture and ethnicity and health literacy. There are a number of projects that have been done here through Mark and Iraj that have looked at the importance of ethnicity and culture in relation to health literacy, and in particular in relation to asthma. So that's going on. Vicky has been doing work in this area, and Laura, right, has been doing work as well. Sorry, when I get this old, I forget things. Anyways, in terms of intervention studies, there hasn't been much done yet, but there's a growing interest in doing intervention studies, some of them that have been done here. Economic studies is an interest, and Scott, again, has led the charge on that, and I think he's going to probably talk some about that. We've had quite a big interest in conceptual and theoretical analysis, and Jim is going to say more about that in his presentation later on. And we've done a little bit on the participatory research front. Our colleague Doris Gillis from New Brunswick did an early project that using participatory research, and Laura Niman over there has also done work on that using participatory research, and there are others who are doing that work as well. So to kind of finish off, yes? Yeah. You think I got enough time? I'm just going to go through this quickly. Just these are some of the trends I see. There's a growing interest in relation to chronic disease and healthcare, growing interest in mental health literacy, which I don't think anybody's really spoken about yet. growing interest in research, growing interest in networking and sharing knowledge and information, and slowly growing interest in health literacy by some provincial governments. There so far hasn't been much interest at the federal level, but maybe. So these are my predictions, and of course predictions often don't come true, but what is probably more my hopes than predictions, that research will continue to develop, interest will continue to grow in the health sector, intersectoral networks will develop in other provinces, provincial governments will develop and adopt policies, and this is my biggest hope, that we'll eventually get a pan-Canadian strategy that is implemented and works. So I'm staking what's left of my reputation on achieving that before I pass away from the scene. So that's pretty much a quick overview of what's happening in Canada. Any one of these could be probed in depth, but at least it gives you a sense of that we're trying to move forward, but it's not exactly a linear process. And in closing, I'd just like to acknowledge the importance of REMA in terms of motivating me personally and helping Canada to kind of move along in the health literacy area. She's kind of been a mentor to the whole country. And we really appreciate that, REMA, and we appreciate that you've come here today to share your wisdom and knowledge with us. So thank you.
Thanks, Sue.